All right. Read out the stem loudly, please.
Okay. Post-operative patient, you will be given a fluid chart, vital chart. In the patient had total 7 liter of crystalloids and colloids. 4 liter of them were normal saline. He is tachycardic, hypertensive, desaturated, and oliguria.
All right. Your time is started, okay, Dr. Sultana. Now tell me, what are the expected physical findings in this patient?
Okay. There is a, I find basal crepitation, neck congestion, puffiness of face, then tachycardic, respiratory, hyperventilated patient.
Okay, so just mention what you mentioned, okay? And beside this, you can mention about this. When there is pulmonary edema, there will be hypoxia, correct? So, due to decreased
Yes,
oxygenation, there will be a confusion, anxiety, okay, tachycardia, tachypnea, cyanosis, okay, and dullness to percussion. Just mention those things. Now, can you read this X-ray for me, please?
yes. Uh, this is X-ray showing the anterior posterior view of the chest, and there is a showing the edema of the alveoli, uh, then obliteration of the costophrenic angle, and dilated prominent of the upper lobar vessels.
All right. So you mentioned the alveolar edema. You mentioned the curly V lines. You mentioned about the cardiomegaly, correct?
Yes, sir, and
All
cardiomegaly.
right. So very good. Now let's go for the next one. How will you manage this patient?
Okay, I manage this patient is surgically ill. That's why critically care surgical. Critically ill surgical protocol follow ABCD approach. Then I sit up the patient. First of all, I check the airway. If patient is talk, then airway is patent. Then check the breathing, assessment of the breathing. If there is a tachycardic, tachypnea, there is a tachypnea patient hypoxic, then sit up
So
the patient and give high follow 100% high flow oxygen, ensure the ventilation, and then check the circulation, pulse, then capillary refilling, and check the cardiac, and check the ECG, and order X-ray. Sorry, not X-ray. Then take hello.
yeah, can you hear me, Dr. Sultana? Okay.
Yes,
So
sir.
you mentioned,
Yes, sir.
You
Then
mentioned, yeah, go ahead from the ABG, ECG, chest X-ray. Then what you will do?
okay. Then I give the fluid. Sorry, I give the diuretics, fusimide, and fusimide. That fusimide. Then
All right, you will give furosemide. All right. So then what you will do?
then give the GTN.
Okay,
Then give
GTN.
the GTN to
Okay.
vasodilation of the cardiac vessel.
Then who will you involve?
Then
All right, very good. You answer almost
I
everything.
involve the I will involve the IQ register, my senior, pulmonary logist.
Okay, very good. So for the management of this patient, I will treat. Listen to me very carefully, Dr. Sultana. Okay, this is how you will answer. You mentioned everything. Okay, just listen to the steps what I am mentioning. Okay,
Okay.
I'll manage this patient according to the care of critically ill surgical patient protocol. First, I'll stop any infusion. Then I'll use high flow oxygen, either non-invasive ventilation or invasive ventilation. Okay. Then I'll sit the patient upright. The medication, including diuretics, furosemide, 20 to 50 mg for the first 2 hours, and then for the remaining, I will use 20 mg IV infusion. All right. Now, I will use dimorphine as a vasodilation as an anxiolytic, and for the GTN, I can use GTN 2 mg per hour if the systolic blood pressure of the patient is more than 110 mmHg. I will review the patient. I'll go for arterial blood gases, ECG, chest X-ray, and I'll ask for a higher support. All right. This is how you will answer this question. All right. So now let's go for the why this patient is at high risk of myocardial infarction.
Because there is tachycardia, then decrease the diastolic time, and increase the cardiac load. That's why there is a ischemia of the heart and causes the myocardial
All
infarction.
right. So there is decreased diastolic time interval because of the increased because of tachycardia, which decrease the coronary filling and increase the cardiac load. What is the minimal urine output?
0.5 ml per kg per hour.
Okay, mention the range. Okay, 0.5 to 1 ml per kg per hour. Can you explain why this patient is oliguric?
Uh, because this patient, uh, mm, this patient.
Okay, you know this.
Oh, sorry. Yes, sir. Because yes, sir. I know this because this patient is post-operative.
Very
So
good.
24 hour, 22, 24 to 48 hours stress response. That's why stress hormone like aldosterone, cortisol is released, and this causes the salt and water retention, and also release the anti-diuretic hormone, which also increase the water retention in the body. And I also think that chronic heart failure causes the retention of fluid
Okay, congestive heart failure. Very good.
and decreases.
What are the fluids given to this patient? You will just look to the chart, okay, and you can see here what are
Okay.
the fluids given to this patient. Can you see this? Crystallites and colloids.
Yes, sir.
So, okay, what are the amount of sodium in 0.9% of saline?
150 milli equivalent per liter.
Millimole per liter. What is the amount of sodium in
Uh,
Hartmann solution?
100, 132
Yeah, 131
millimole
millimole
per
per liter.
liter.
Yeah. What is the daily requirement of sodium and potassium?
As potassium is 0.152 1 milli equivalent per liter, sorry, kg, and sodium is 1 to 2 milli equivalent per kg.
Okay, 0.5 to 1 milliequivalent per kg sodium, potassium. Okay. What can be done to prevent this from happening again?
Okay. First of all, I take. First of all, I investigate that how it's happening. Then I monitoring the patient by urine output and central venous pressure. Then I will report the hospital incident system. Or
Okay. So also
okay,
you will
then
give.
I also
Yeah, yeah. Go ahead.
I also better advise the better training of junior staff to
Very
follow
good.
the guideline.
Very good. Now I will ask you a few questions more. Can you tell me about the ionotropes and vasopressors?
Yes, only name or
Just tell me simply, like ionotropes, how it increase.
oh,
Yeah, yeah. Go ahead.
inotropes is the Inotro's function is the increased heart rate. And vasopressin is causes the vascular constriction,
Okay, so
like
the
atropine.
okay, so inotropes drug increase the cardiac contractility. It acts via the autonomic nervous system. The example including the adrenaline, noradrenaline, and dopamine. The vasopressor drugs increase the
Yes,
vasoconstriction and increase the mean arterial pressure, and it also acts via the autonomic nervous system. The example including the vasopressin and the noradrenaline. Correct. Now,
yes,
the receptors that it will act upon is that adrenergic alpha 1 receptors. It will vasoconstriction and inotropics agent will act on it. Okay, the adrenergic beta 1
yes,
receptors, it's mainly in the heart, and the inotropic chronotropic agent will act on it. The adrenergic beta 2 receptor is on the vessel wall, and mainly the function is if it activates, it will lead to the vasodilation. The D1 and D2 receptors is present in the kidney, it will lead to diuresis. Remember this, okay? Now, let's go
yes.
for the few new questions that's asking in the exam. All right.
Okay.
The first question in this case, they will ask you about the. Okay. So, what solution you will use if this patient required fluid?
Crystalloids.
Yeah, the crystalloid normal saline. Okay. You will accept this answer,
Yes,
remember.
crystalloid
Now,
dollars.
what is the management of cardiac failure? Use preload and afterload
Cardiac
effects. Remember, okay, this patient is.
treatment.
No, no, listen to me very carefully. What is the management of cardiac failure? Use preload and afterload effects, okay? Now, you cannot use any drugs
Okay.
because the patient is hypertensive. Remember this, okay? Like, you cannot use any drug like inotropic support. Just be very careful, okay? In this scenario. So, what you will do, you will reduce the preload, all right? To reduce the workload on the heart, you will use diuretics, you will use nitrates. Now, you can reduce the
Yes.
afterload by giving him vasodilator. You can reduce both the preload and afterload by using the AC inhibitors. And to stimulate the cardiac
Yes.
contractility, you can use digoxin. Remember this, all right?
Yes.
All right.
Okay, sir.
So, after this, I think we cover most of this station. Um, what is new here? I think that's it.